quick.
Please.
Yeah, maybe. You want to spin?
Spin.
Yes. Oh, I see. Just got better. Okay, so on the outside, before we get to the inside, we do want to show the lateral line shown right here. I just touched it with my bare skin. Lateral line right here. I'm gonna die. And then if you take a look at the ventral side, you look at our clasperless pelvic fins. That's fantastic. So, ready? So here we have our assistant. So when you open this immediately, there's a few. Someone being charged to give me applause. Someone. Well, you see a few things here right off the top. First of them is just giant liver. Look at that, giant liver. And that's okay, that's what happens to you. Assistant. Yeah, and we'll talk about why they have such a big liver when we get to it in lecture sometime in April. Is that this month?
Yeah.
2018.
Yeah, 2018. So we'll start with the digestive tract then, and
It's eating its molt.
and we have right here. This is the stomach. Now her stomach was a little strange because her uterus was kind of full and everything was kind of pushed around. This is an ovary here. It's a very well-developed ovary. This shark is an adult, probably 6 or 7 years old. This is the spleen right here, this big piece. And then we have the duodenum here. So this duodenum makes a kind of an S shape. Stomach comes down, goes back up and back down. So that little squiggle is the duodenum. We have 2 pieces of the pancreas. There's one piece right here, and the other piece is right here in the mesentery. So 2 unconnected pieces of the pancreas, same function, but 2 different things. Again, that's the mesentery. Here we have the ileum. It's homologous to the intestine of most other regular animals. It's kind of short for the length of the shark, but there's a trick inside, and the trick is to not allow the food to go right through. In fact, it's got an adaptation for greatly increasing the surface area. Why did I make the incision there? Anyway, if we kind of flap this open and take a look, you can see all sorts of dividers, right? This food is not allowed to go shoot straight through. Instead, when it comes through, it goes around and 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 around. Increase the surface area. So the effective surface area of this very short organ is maybe 4 or 5 times the length of an organ that would be similar. And then down here near the rectum, we have a gland called the rectal gland. It's used for chemical communication. Hey, whose poop is that? Well, that's this shark's poop. The membrane that Brooke is touching here is called the peritoneum. And if you would describe the texture of that to me, how would you describe it?
Oily.
Oily. She's practiced that. It's oily, and it's oily because, well, what do you know about oils and water? They don't mix. They ever get a bowl of soup? Where does the oil go in a bowl of soup? Up to the top, so oil is less dense than water. And this animal uses oil for buoyancy. If you're down here at this end, you can probably see a little bit better than we could on the other shark. We have those ampullae of Lorenzini in this area here, right? And then also, if you're down on this end, good luck because you get to see this. You guys don't, but we'll do it again. We'll turn them around and do it again, okay? So we have a structure. This is the pericardial cavity, and there's a structure right here. You want to point to it? There's a structure right here called the transverse septum, and it's analogous to the diaphragm. It separates the pericardial cavity from the abdominal cavity. Not muscular. They don't use it for opening up their lungs. Why not? No lungs. So then it's just a divider. And then this big muscly part, keep going, I trust you. This big muscly part is the ventricle, and of course that pumps the blood out through the conus arteriosus. Yeah, that big tube anterior out of the heart. And if you lift up the ventricle, there's a triangular structure underneath called the sinus venosus.
Can you guys turn it this way?
We will. We'll turn it. So there's the sinus venosus. And so the order of the blood flow goes sinus venosus, and then we'll flip the ventricle down. And we have the atrium, which is kind of the pillow that the ventricle rests on. And then we have our ventricle, and then we have our conus arteriosus. So if you're on this end, we'll spin her around, and we'll do it again. All right, so our transverse septum is this wall right here. There's our transverse septum, separates this area from this area, so pericardial chamber from the abdominal chamber. And then we have our conus arteriosus right here, this big blood vessel. And there's our ventricle. There's our ventricle. Yeah, I realized it wasn't doing anything. And then we flip this forward, this triangular structure right here is the sinus venosus. And the pillow right here that it's resting on, oh, I didn't cut it, look at that. The pillow that this ventricle is resting on is the atrium. So here's the order. It goes sinus venosus, atrium, ventricle, conus arteriosus. And that concludes the tour for the shark.